And we are back on Open Line with Dr. Christopher Sandlin from Bluegrass Endodontics. We are talking about your teeth, everything from root canals to the best way to floss. As always, that number on your screen, 737-7587, is the number that you can call. If you have any questions or comments that you would like to pass along to us, we'll get to as many calls as we can this evening. Right now, we are going right back to the lines. Lydia is on the phone with us, so good evening, Lydia. Do you have a question or comment for Dr. Sandlin?
I'm 75, and I've never been in a dentist, and I have all my teeth but one. This tooth is almost in the back, and it drains white, real white, and then it fell off. But the roots are in there, and sometimes it hurts me, but I put antibiotic, cream antibiotic in the hole, and it goes away. Is it a very serious thing? So, see, I have no insurance. So it's kind of, I do it on my own. Is it a danger to put antibiotic in the hole? Hello?
Did I understand you correctly? You have a tooth that's broken off and there are root tips below the gums?
It's a hole on it, really big hole. Sometimes as big as a bean. Sometimes the whole bean goes inside. But I put antibiotic in the hole when it hurts. And the pain went away. The pain goes away.
Is there a portion of the tooth that's still down in that hole?
No, the tooth fell off. I probably swallowed. I never see it. It was white, real white, and then it fell off. But the roots are in there because I feel it. I put my finger in there, and it's something hard in there. But not the tooth. The tooth
something
is
hard in there?
It's about the three tooth from the end. I don't know what you call those tooth. They are funny looking, they're real fat, the number 3.
Well, if there's a question about whether there's a portion of the tooth that's still remaining in the socket, an x-ray or radiograph would probably be the best way to determine that. As we were talking during the break, sometimes antibiotics can be a band-aid, especially with certain dental conditions, that won't necessarily solve the problem. So you may take antibiotics or place antibiotics and get some temporary relief, but until you address the real source of the pain or the infection, that problem will keep reoccurring until you address. And in this case, if there are remaining decayed root tips that might be down in that socket, your general dentist or oral surgeon might want to take a look and remove those pieces so the socket can close up correctly.
Oh, it's very expensive, right?
The cost, that's just part of...
Yeah, it's variable depending on what's going on. There may be nothing down in there. It's hard to say.
There's something in there. I feel it with my finger. It's like a finger that's got like points on it. There's something in there.
So basically, the advice is go see the dentist.
Go see the dentist.
Yeah. So.
Thank you.
Okay. Thanks so much, Lydia. We appreciate it. All right, we're going back to the lines right now. William is on the line with us. William, good evening. Appreciate your patience. Do you have a question or a comment for Dr. Sandlin?
Yes, sir. I have, it's dealing with fluoride. I was wondering if, by any chance, if you have fluoride in the water, if you boil your water, if it will take away the fluoride.
Why would you want to take away the fluoride?
Well, it's just a question that, that I was curious about.
I don't know the answer to that. I haven't tried to do that. Generally speaking, I mean, the studies have shown that the very minute amount of fluoride that typically is placed in water does an incredible amount of good for the oral health of the population. So obviously anything in excess is not good, and fluoride is an example of that. You wouldn't want to drink fluoride, but the small trace amounts that are in our drinking water provides a very valuable benefit.
Yeah, I was just curious if it would, if you boiled the water, if it would take it out.
I don't know. That's a good question.
But the good thing is that the fluoride that is in your water is something that's good to drink.
It is.
Yeah. So, well, William, we appreciate you calling in this evening.
Thank you.
You bet. Thank you. All right. Now, speaking of when people talk about fluoride and tartar buildup and things like that, let's talk a little bit about recommended toothpaste and are there toothpaste out there that you think you would definitely put your seal of approval on and some that you're not quite so sure about?
You know, me personally, I don't have a favorite toothpaste. I'm in favor of people using toothpaste. You can get kind of bogged down in the minutia of this one is better than that one is than that one. And in reality, if you're using toothpaste, if you're using it in a proper brushing technique, you're going to be fine. The only distinction I make when it comes to recommending certain types of toothpastes generally comes when the subject of sensitive teeth comes up. And in that case, I'll generally recommend something along the lines of a Sensodyne or Colgate Sensitive, something along those lines. And generally, if people are having a generalized sensitivity to cold water and things like that, I'll ask them what kind of toothpaste they're using. If they're using an abrasive toothpaste, something with baking soda or these extreme whitening toothpastes, those are going to exacerbate that cold sensitivity. And I'll just recommend that they maybe switch. So there's a trade-off. With the more abrasives and the whitening, you get a more sensitive. But as far as just general home care, put the toothbrush on the tooth, any toothpaste, very, very small amount will be sufficient, and they'll all be fine.
Okay. I'm going to ask you a few more questions about proper brushing and how many times and that sort of thing. But right now, we're going back to the lines. Carol is on the phone with us. So, Carol, we are glad that you called in. Do you have a question or a comment?
Hi, yes, I have a question. I'm in my mid-40s and I still have a baby tooth. And they said my permanent tooth is laying sideways, I guess, up in my gum. And I was just wondering, is that a concern? Like, I was told by one person that you can get a cyst and it can turn into cancer or anything. And I was just going to see if he can answer that for me.
All righty.
That's a pretty common occurrence. An oral surgeon would be the best to consult on cases like that. If that impacted tooth, and that's what it's called when that tooth is in an improper position, it's not able to freely come up and push the baby tooth out. If that impacted tooth presents a problem in its position, or if during the course of routine examinations and radiographs they notice changes in that little follicle that the tooth sits in, then it may be time to extract that tooth. At 45, if it's impacted, chances are it's probably something that's better left alone, much like a wisdom tooth that's completely impacted. You've probably kind of missed the ideal window as far as extracting that, but oral surgeon consult, he may be able to shed some light on that. Sometimes, if it's not too malposed, they can actually surgically reposition it and pull it up into its correct position and remove the baby tooth, but we'd have to look at radiographs to make that determination.
Okay, thank you.
All right. Have a great evening, Carol.
You too. Bye-bye.
Thank you. Bye-bye. Now, what you mentioned wisdom teeth. Should you have your wisdom teeth out? I know at one time that there was, they said you want to have the wisdom teeth out. A lot of people still have wisdom teeth,
right,
as they grow older. What's your advice there?
It's a function of, do you have the space in your jaw for it? If you have room for it and it can erupt and provide function and it's in a cleansable position, then keep it. Generally speaking, we can make that determination, or an oral surgeon can make that determination at a pretty young age based on the size of your jaw and the position of the tooth. If there's not room for it, extracting it at an early age, 15 to 20, is ideal. As that tooth continues to grow as you age, even though it may not come in all the way, the roots continue to form. They can form hooks around the nerve. Your body doesn't heal as well. So there are a number of benefits to extracting those wisdom teeth. As soon as you can identify that, number one, you don't have room for them, they're never going to come in, or they're not in a position where you can keep them clean.
All right. Well, that is good to know, too. When we were talking a little bit earlier about fluoride toothpaste and which ones to use and your recommendations and for sensitive teeth, what is your general rule of how many times a day should someone brush their teeth?
Well, the common wisdom is brush after each meal. I mean, you want to remove that food debris, those sugars that coat your teeth. You can't get rid of the bacteria in your mouth, but you can certainly reduce the amount of food that they have to feast on. And if you remove that food stuff from the teeth, they've got nothing to latch onto and create that lactic or that acid which erodes the tooth. So different people have different requirements. Some people can get away with brushing once a day, and then some people really need to brush more often based on the way their teeth fit together, the way they crowd, the bacterial makeup of their mouth. There are a number of factors. Some people develop more tartar. Some people have a more acidic makeup in their mouth, and that's more conducive to cavities. So it's hard to say, but as a general rule, after each meal.
Okay. What about mouthwash? Because I know some people think I can just get up in the morning and use mouthwash. I don't have to brush. And then I've got a second part on that, but go ahead and answer that one.
For me, it makes your breath minty fresh. It kills some bacteria for a certain amount of time, but they're going to come back. The best answer is to physically remove those bacteria, not only from your teeth but also from your tongue. A lot of people don't realize a good percentage of the odor that comes from bad breath is actually coming from the tongue. So I really recommend a good vigorous tongue brushing there. But as far as reducing the overall bacterial load in your mouth, as a temporary fix, mouthwashes can be temporarily effective.
But it doesn't take the place of brushing?
No.
Okay, it doesn't take. All right, I'm going to ask you part 2 of that when we come back from the break, because right now we do have to take a break. We are open line. We're talking about your teeth. So if you have some questions or comments, do give us a call at 737-7587, and we'll take those calls right after this.